So, Grady, can you say hi? Say hi. Say hi. There he is. So he's saying hi. This is Grady Welch. He's 9 years old, and I'm Andrea, his mom. So he came in here with uncontrollable seizures, and he was in status where he was having a seizure that wouldn't stop. So we've been here for 3 weeks now, and we are currently in the pediatric intensive care unit. There was nothing different. He was 9 pounds, 2 ounces, 22 inches long, big baby boy. No issues otherwise. I mean, he ate well, he grew, so there was nothing that we would have ever questioned on that standpoint. So on October 26th of 2009, Grady had his first seizure, and we really didn't know what was going on or what happened. And then we really thought it was just febrile seizures, just a seizure. It started because he had a high fever. After a week of realizing that it wasn't caused from a virus or any other kind of illness, they actually went away, and then we were about a week seizure free, and then the next week they started back again. So we ended up down at Arkansas Children's Hospital, where we were hooked up to a 24-hour EEG, just hoping and praying that he would have a seizure so they could see exactly what we were seeing at home. And it took toward the end of the 24 hours for him to finally have one. So we were so thankful that they were finally able to see a seizure. And the neurologist had actually told us that they could see abnormal brain activity the entire time, and they were seeing seizures the entire time. And they had no clue why he was not having seizures prior to this, that they had just started. They said that he should have been having seizures his entire life, and that he had an abnormal brain structure from birth, and that they couldn't determine why he could walk, why he could talk at the time. To say he couldn't talk real well, but he could verbalize some things, and they couldn't understand why he could do all those things. So they were kind of like a mystery to him that, you know, Grady really just started having issues overnight. But we got him on some meds and some seizure meds and helped to control the seizures as best we could. And then about 6 months after that, Grady ended up getting airlifted for the first time for uncontrollable breathing, uncontrollable seizures, very high temperature. And that's when they realized that he was aspirating everything he ate, so everything was going straight to his lungs. And so that meant that that was his first real surgery, and he had to get a G-tube placed, or a button. So it's pretty much everything is fed straight into his stomach. And that was really the start of our realizing that Grady was going to be more of a medically, chronically ill child, and that we were going to be forever part of Children's Hospital. He was 2, and then he's 9 now, so we've been dealing with this for the past 7 years. When Grady first went in 2009, when he first started having the seizures, they did do some genetic testing to determine what he had. They sent it to specialists who actually specialized in what his brain looked like, his structure, and everything kept coming back negative with no answers. Finally, about 1.5 years after that, we finally got some blood work that came back that said he was positive for the LIS1 gene defect, or he had lissencephaly. So it means he has a smooth brain, so he has bands of smoothness in his brain. And like us who have ridges and folds, he has those bands of smoothness that cause him to have the seizures, the delays, and it was just his brain didn't develop properly. We've been on Angel 1, how many times? I think we've been on Angel 1 8 times, and then we've also now taken, we've had to use another transport because Angel 1 wasn't available. So we've been on Angel 1 8 times, and one of those times, actually, he had to take a jet because Angel 1 wasn't available then either. So we've had a couple different experiences. The neat thing about Angel 1 is usually, depending on how many people come on the helicopter, a parent gets to ride as well. We've never had a time on Angel 1 that one of us didn't get to ride with him. The other thing is that they have a TV on there, so if kids are awake, they can actually watch a movie and make the flight a little bit more bearable to get them here. But there's always usually a doctor, a nurse, and a respiratory therapist who's on, at least for ours. So I'm sure it depends on what your child's going for, but that's always been our case. So when we first started out, I know it was at the very first flight, his was like $11,000, and of course that was 7 years ago. I know it's gone up since then, but that was literally an hour flight from Northwest Arkansas down here to Children's. So we see several specialists here. We see neurology for his brain and his seizures. We see pulmonology for his lungs. We see our ENT doctors, the ear, nose, and throat, for his trach. We see genetics. We've seen surgery, because surgery still deals with his G button. We see immunology, because he's also immune deficient, so we have to see them for some of his medications. We've seen GI doctors here. We also see medical home. So we see several different specialists that have really helped us to be a total care package for him. So Grady is considered medically fragile, and what that means is he has a lot of medical issues that make him nowhere near the norm of what a normal pediatric patient is going to be when you see them come into the hospital. So for Grady, when we go to the ER, we really know before we go, we're at the point where I know we need to be in the hospital. But most of our ERs around the area are very scared of Grady, and they will not admit him at all. And we know that, and that's okay, because we know we're going to get the care at Children's. So for us to have a hospital, Children's, right there in Northwest Arkansas, it's great, because we can go to the ER and they're already going to be able to talk to all of his doctors. We're in one hospital, they'll see all of his medical records, and they're not going to have to guess on anything. It's all in there. And so that's going to really help us to be able to have a true picture, and to be able to not have to, explain his case all over again, or have, just having doctors that really know that they have to take care of Grady, and that they are willing to because they know that they can. That's going to be a big difference for us. So the thing here at Children's is they really love children. The one thing I love about hospitals, and I learned this one time because we were actually here during a major snowstorm, and as a patient, you can't leave and go home. This is your home while you're sick. You have to stay here. These doctors and nurses, many of them never left the hospital because they knew if they left, they couldn't come back, and there would be nobody here to take care of the patients. So they do that not because they have to, but because they also want to. They realize the need. The other thing with these doctors and nurses and just the whole entire staff is they make it better for the kids. They try to make things that are more fun. They realize that kids, it's hard for them to sit in a hospital bed when they are starting to feel better. So, we have wagons to take wagon rides. They have toys that the kids can play with that they'll bring to their room. They have magazines, they have books, they have movies, they have video games. Anything they can do to make the child's life that much better while they're here, that's what they're here to do. So it really is, it's a whole different atmosphere than an adult hospital. And it needs to be that way, because that's what makes you want to be here and want to know the people, and you want to have a better relationship with all those doctors and nurses too. But we love Child Life too, because honestly, I don't know if you can see behind, but we have cards, pictures. We do lots of things to make our room brighter. Child Life helps us with some of those. Whether it be we get cards that we get sent to us, what we'll do sometimes with those is actually decorate them up a little bit, put them on some construction paper, a poster board, and actually decorate the room with them. Child Life also, if the kids want anything, or there's a special toy that a kid really, really loves, they'll do everything they can to find that toy. They're also here for the parents too, so if a parent wants a crossword puzzle or something like that, they'll go and try to help you find that as well. So they're really good about trying to make it something where both the patient and the parent are comfortable with being here. Oh yeah, siblings too. If there's something that one of the siblings needs, they're right there to take care of it too. So Dawson is great. He's 12, and he's never had any real major medical issues at all. But the hospital all knows him. They know his name. All of his doctors know him. Even at the hospital, a lot of the nurses, when he comes in, they're high-fiving him. They'll ask him how his day went, how his weekend went, how school went. So it's nice because he feels like he's a part of the hospital too. And we're not just about Grady being in the hospital. It's about the whole family, and they get that. So it makes it a big deal when they can treat your whole family like you're part of us. He came in to get he was having some breathing issues, so we had a surgery done where they were going to laser off the top of his airway because it was floppy, and that was to open it back up. Well, the surgery didn't work, so they ended up putting a trach in the week after that initial surgery. And so that had us here for 3 months, just trying to get recovered and get able to get back home. So we were able to spend a lot of time here, got to know a lot of people, got to really become Little Rock was our home during this whole stay, but it was good. We were able to get through it, get home, and you know, feel a lot better. The one thing that Children's does is they never let you go home until you're ready. And so, you know, we were ready to go home. We had to work on some other issues with paperwork and insurances, but I think that that's a great thing. They will never push you out. They want to make sure you're comfortable when you go home. And so that means if you're here longer than what, you know, other hospitals think you should be, it's okay, because you need to be comfortable with what you're dealing with when you go home, because you're the one who has to deal with it. So they're really good, and we're really glad that we were able to be here during that time to have that experience with all of them. So, yeah, our therapists who come in, our OT, our PT, our speech therapists, they all really try any way they can to get the kids to engage in therapy. And so, like, Grady is very, very stubborn, and sometimes he is asleep when they come in, and he's really hard to wake up. But that doesn't stop them from doing therapy with him. So they were, you know, singing with him. They'll bring in balls because they know he loves balls. They bring in musical toys because they know he loves that too. They have a bike that they take him on whenever, hopefully he'll get better over here, and then he'll get to ride the bike. So they have lots of different things that they know each kid is individual, that each kid likes, and so that's what they do to help get therapy going. They want to make sure you leave here back at your base, and the way to do that is to make sure you're walking and you're mobile, or you're sitting up, or whatever your base is. That's what they want you to leave here and be able to be comfortable with. For us, it's going to be good with the hospital being in Springdale, just because right now we're 3 hours away, so we are only like really together as a family on the weekends, since my older son is in school. And so with the new hospital, it will really help a lot, because then we won't be so far away, and we'll all be able to still stay together and be together, and just not have to, you know, worry about the delay and not seeing each other. So it'll be a really good thing for us, and we're really excited about it, and about how it's also going to help just the entire Northwest Arkansas area too. So the Lowell Clinic is really, it's great as well. The Lowell Clinic is where all the specialists either currently stay, or they come about once a month or more to be able to see patients. So it's really good for us, because we may come down here for, let's say, a 30-minute doctor's visit, but we've spent 3 hours driving down here and 3 hours driving back. Where with the Lowell Clinic, pretty much you could do that on a lunch hour and be able to get him into the doctors, get him back to school, and then you're back to work. So it's saved a lot of time. The other great thing about the Lowell Clinic is if we're going there for neurology, pulmonary is right down the hall. So usually we'll go by and say hi to them, and if we have an issue, we get it taken care of right there without an extra doctor's appointment. So it's really helpful to parents and to patients who have multiple specialties that they have to see, because they're all in one place together. So the hospital really does try to cater to each one of the individual kids and how they help them to be able to get back to their baseline. So I know Grady was on isolation at one point in time, which meant that he had some bacterial infection and he couldn't be actually out of his room. But he needed therapy, so they would come into the room to do therapy. Well, it was also when it was starting to get really nice and warm outside, and Grady loves to be outside. So we had made a special request to see if we could go to the playground area where most of the time patients aren't at. But they couldn't do that. But instead they came back, and they actually have a therapy up on top of the roof. So they allowed him to go up there on top of the roof and do therapy and made sure nobody else was up there doing therapy at the same time. So it was really great for us, because I think that's a big deal that they could do that. And they made accommodations for him so that he could be able to get outside, and they know that that helps the patient get better. So it was neat, and also it was kind of neat being on the roof of the Children's Hospital too, just playing games, throwing a ball. So the good thing I feel with the hospital and with our doctors and our nurses, especially probably the nurses, you get a really big one-on-one connection with them. So they're part of your family while you're down here. They know about you, they know you're venting, they know when you're having a good day, a bad day. You know, I work while I'm down here too, so they really help me out when I'm like, I got a conference call. They're like, go ahead, Mom, we got him. So they're really pretty much your family, they are. And that's, I think, one of the best things about Children's, is that they are your family. And I mean, we wouldn't want it any other way. I mean, we have doctors that, like, I don't know, like, we just love them to death, and they love us, and they know that there's more to being in the hospital than just you're sick. There's that family, there's that relationships that they build with us that make it go so much more than just that. That's a great thing about the nurses. They realize that moms and dads need breaks as well, or the caregiver. So they, you know, really try to get you to get out of a hospital and not just sit here all day long. So especially on the weekends, like I said, they know that I usually work while I'm here in the hospital. So on the weekends, they try to get me out of the hospital. And I'm so glad they do, because you have to take care of yourself as a parent. And sometimes you don't feel like you can. You don't feel like you can get out of the hospital. It could be just the guilt factor, or it could be because you don't think anybody can take care of your kid either. You just have this ownership, you know, that parenting over your kid. And but it's nice whenever you can trust the nurses to know that they're going to take care of your child, and they're going to be just fine. I mean, literally they're in the hospital, so they know what to do in the hospital. But it really made me feel good whenever he would just push me out and say, "Mom, he's mine for the day. You go. We're having our boy time. It's our time." And so he would take him on the weekends and on Saturday and let me leave and go do some shopping or just go outside. You know, go to some festival or just something to have a little bit of a normalcy while you're here in the hospital. I think the biggest thing is, it is really ironic that last year we were there enjoying the dance marathon, and I think, you know, if you were there last year, you saw Grady and how he loved watching everybody dance. He loved the music. He wanted to dance and play and sing. Well, sing, you know, he loved listening to y'all. He loved when y'all were dancing. He thought that was amazing. And this year, unfortunately, we're not able to join in. We apologize, but I know if Grady was there, he would be walking up trying to get on stage with y'all again, even when it's not really the right time. But I think that this goes to show you that this is, that things can change so quickly that you don't really plan for things, but we always need the hospital. So we need your support today more than anything. Because we do have a new hospital being built, and at one point it's going to be, you know, we're going to be adding on, and it's going to be even more than it's going to start out to be. But right now we need that just to help out Northwest Arkansas, as well as just add that addition to Arkansas Children's, because nobody plans to come, but when you're here, you're so thankful that it's here, and we're thankful for all of y'all for helping to put this on, and just keep dancing away and keep raising the money for us, because our kids need it now, and your kids may need it tomorrow. So, thank you so much. I love you.